I'm going to explain how to do a quick progress note in ECW. So the first thing, as you know, is the chief complaint. So here you do add, and for example, we're going to do headaches. You can use Dragon, and you can just say headaches for 2 weeks, and then add the chief complaint, and then in HPI you can go and start. This is an 86-year-old female coming to the clinic complaining of headaches for the past 2 weeks period. Patient described as a aching bilateral headaches for the past 14 days. Period pain is 5 out of 10, comma, intermittent, comma, located in both parietal sides of the head. Sometimes the Dragon doesn't recognize the voice, so you can just write down. Per patient, comma, pain improves with Tylenol. Period, pain gets worse during physical activity or stress. Period, patient had headaches like this since she was around 40s. Was on her 40s. Period. Per patient, comma, pain lasts for about half an hour. Period. At this time, comma, patient denies blurry vision, comma, loss of consciousness, comma, patient denies the worst headache of her life. Period. Patient decided to come to clinic for medical recommendations. So this is just an example of how to do your HPI, but everyone does it differently. So then we go to medications, and you can bring past medications that patient has, or external, that means for another clinic. We won't do it in this time, but you can do it. Or you can bring and write down their own medications. So if you verify medications like patient is not taking any, you can you can click verify. This is for medications the patient are taking a daily basis, not over-the-counter PRN. We verify medical history. If the patient doesn't have any medical history, you click verify. If the patient doesn't have allergies, you click here. But for example, patient had an allergy to a structure medication, for example, amoxi. So you can write amoxi here, and then the reaction, you can say, oh, patient developed rash, and it's a side effect or it's allergy. You can describe it here, and the status is, oh yeah, she had it when she was a child, but not anymore. But if she still have it, you can click active. And then gynecology history, you can write it down here. For example, last menstrual period, so you can write down all these. So for example, as last menstrual period, you can say 60 years ago or 30 years ago, whatever the age will be, and you can say it if how many pregnancy the patient has, etc. You can follow accordingly. Surgical history, for example, patient had in 1998 patient had a hysterectomy, so you can even dictate hysterectomy. Any hospitalizations, so you can click it. Same with family history, you can go in detail on the family history, or not contributory, so you can go in details. social history. So basically, is any alcohol, any tobacco use. You can just follow and fill out these, or I have some templates that I have, like for example, denies exposure to secondhand smoking, or denies alcohol, drug, tobacco abuse, denies no sexual activity at this time. So you can do that. And then for the roles, I have my own templates. You can create your own templates, and in this case I create my own templates, and here is, you can easily have your roles template. For vitals, usually your medical assistant put the vitals. Examination, you can go very quickly and do template. And then for example, you said, oh, I didn't do a skin, so you come and clear the skin. And you said, okay, I want a more detailed neurologic, you can even clear this and look for more detail. You go to examination and you go to show, scroll all the way down, and you go to neurologic. I have my own template for neurological, and you can describe and you can go over and see what you didn't do. You can erase it, but you can say, oh, I did this test more in a different way or more detail. You can go and modify anytime. You can click here lungs and modify anything or erase it or add, etc. So, and then for assessment, you can use your dragon and set headaches bilateral, and then just click enter, and then you have diagnosis. And then for treatment, you can go here. You can go to browse anytime, and you can create your templates of headaches, or you can just write it down. ER precautions were given to the patient, etc. So you can dictate or you can create your own templates. For medication, you go to add, and then you can write the medication, like for example, you want Excedrin or Excedrin migraines. You click here, you click the dosage, okay, and then you can easily e-prescribe, print it, or fax it. So for the most part, we do e-prescriptions. You just click here. Sometimes you need to modify. For example, here it says 2 tablets every 6 hours. How many days you're gonna do? Maybe 5 days, so it's 40 tablets. So remember, this is 2 tablets as needed. You can modify if you want every 8 hours, every 3 times a day, 4 times a day. You can modify. You can even write every 8 hours. So now the tablet's reduced to 30, and if you want refill, no refill, you can say apply, and then you can e-prescribe, and you click here, and then it's gonna e-prescribe. Right now it won't, because we don't have assigned any pharmacy, but we will assign the pharmacy. And for the most part, in the front desk or your MA is gonna assign the pharmacy. But if you don't know, if you don't have any pharmacy, you can ask your patient and write the city. For example, San Jose, and then you look for CVS, and you're gonna ask the patient which is the CVS that is closest to their house. So you assign the pharmacy. You can set up as a primary. You do eligibility. So eligibility is gonna check what insurance the patient has, and according to the insurance, they're gonna give you options of prices of the medication. If the patient doesn't have any insurance, it's gonna be an X, a red X here, meaning patient doesn't have insurance. So here in this side is gonna tell you the amount of the possible amount of medication. If it's generic or if it's brown, it's gonna give you the amount of the patient. And if it's green, it's covered. If it's red, it's not covered. If it's yellow, it may cover, or it may need pre-authorization or TAR. Then after you send your medication, you do preventive medicine. And preventive medicine, you can go to browse. I already have my templates for headaches. So one of the templates that I have is a headache diary. You can click it, and then you go, the last thing you're gonna do is your visit code. So established care, or it's a new patient, or it's established, level 3 or level 4. In this case, I'm gonna do established level 3. Okay, follow up in 1 week to see how the pain is going, and then you can click done. Done means you already are done with your note. So this is how your note will be. Thank you.